Welcome to the DEI public lecture. My name's Simone Abram. I'm the director of the Durham Energy Institute. Nice to see familiar faces and some new ones as well. Welcome, everybody. I'm thrilled that today we have Adam Scorer, who's the Chief Executive of National Energy Action, to talk to us. I'll tell you a little bit about Adam. Adam's been the Chief Executive of NEA since 2017, and NEA is a charity that campaigns against fuel poverty in the UK. He's been a consumer rights campaigner for many years, including at major UK consumer bodies such as Which, Energy Watch, Consumer Focus and Citizens Advice. And he's also been a member of numerous industry advisory boards and committees, from civil aviation to insurance fraud. So fuel poverty, consumer vulnerability and the challenge of decarbonisation have been key drivers through his career. And we had the pleasure of hearing him speak at the Energy Day, the DEI Energy Day last autumn, and it was very inspiring. So we agreed that I wouldn't tell you what the title of the talk was, because he's going to probably deviate from the title. But just before he starts, there's just one thing that we may take a few photos, and we did ask on the way, and if anybody did not want to be photographed, that they wear a little sticker. But if nobody's got any objections, we might take the odd photo to publicise. It's also being recorded, and it will eventually end up on our YouTube channel. So thank you very much to everybody. And Adam, we'll speak for about 30-40 minutes, and then we'll have questions. But I think if questions come up.
Absolutely.
Thank you. Over to you.
Yes. When you come with questions, please ask them. So thank you very much, Simone. First of all, I need to start with at least one apology, but maybe quite a few. I've called myself the Chief Executive of the Durham Energy Institute, which is not what a good guest should do to their host. So apologies for that. I genuinely don't make a habit of that.
You're welcome to join me.
You can find any other way of breaking it to you. The second is the title bit is absent. There was a title that was circulated with a brief, and please, if you read that and that's why you wanted to come, please ask questions about it. But I think the honest truth of it, even though this is a public lecture, it's kind of like private therapy for me as well, which is appropriate, because some of the things I'm talking about is the concept, the treatment, the response to the idea of crisis. I'm trying to think, and I don't normally speak for this amount of time, and I never use slides. So I've been trying to find ways of making this as comfortable for me as possible, possibly as least illuminating for you, I'm afraid. But that's why I've deviated from the title. But please, if you want to ask questions about that, please do. The last one is I'm drinking elderflower presse, which is lovely. It's quite bubbly, so I'm hoping that will interfere with it. So yeah, so I am Adam Scorer, the Chief Executive of National Energy Action. We're the only national charity based in Newcastle. There are a couple of others in the northeast. We were born out of this institution, out of Durham University, from students who wanted to do what they could to support older people struggling with fuel poverty by putting insulation in their lofts. And from that, we grew to a neighbourhood energy action, and then to a fully fledged national charity, by which I mean England, Wales and Northern Ireland. We have a sister organisation in Scotland that works for it. What we do is more important than what we're for is probably more important than what we do. Our mission is not that energy bills should be this percentage lower than they are at the moment. It's not that a certain number of houses should be at EPC C. It's none of that. Our mission is that everybody should be able to afford to keep their homes warm and safe. The outcomes are quality of life. It's the way in which beneficiaries, our clients, the people we represent, are able to be assured of a sure start in life that everyone deserves. I think it's understated, and we'll come to this at the end, just the role of the home as a place of refuge and respite and comfort and pleasure and joy, not a place of dread, frustration and ill health. So the fuel poverty concept for us, our prefix fuel, is hugely important. That's our big focus. That's our area of expertise. That's where we think we have our change the world moment, but the outcome is much broader than that. And that's also one of the therapeutic kind of issues I'm trying to deal with today, about how to understand that coming out of cost of living crisis, which has been so much more, though supercharged by energy costs, has been so much more than just the experience of a transactional difficulty in affording an energy bill. because there was lots of talk from the pandemic through to the cost of living crisis. We're in this together. We're all in the same boat. This is a shared kind of crisis. And while it's certainly true that we're in the same storm, we're not necessarily in the same boat. And the differential experience of energy costs, of the cost of living crisis, has been particularly acute. So that idea of crisis is something I want to get to. We have a definition, or we have a way of using crisis. Definitions, etymology, sometimes useful, sometimes not.
Just going to move this out of your way.
Okay. The definitions in etymology are sometimes useful, but sometimes not. I have a way, the way we talk about crisis is a very client-focused one. But a crisis is when your coping mechanisms fail you, when they desert you, what you've relied upon, what you've had to make work, they just disappear. And you're left with closer to despair and desperation than you are to being able to cope. And I relied on Thought for the Day for this, so this is not because I'm an academic Greek speaker. The Greek root, krisis, is decision, judgment. It's a point in time when a decision is made. The typical Middle English use was a medical one. It's the turning point, that point at which a medical condition worsens, point of inflection. All these things are pretty relevant when you think about the way in which we've responded to the cost of living crisis. It's had a sense of urgency, of focus, of universalism, and of expedience, getting things done. Most of those are pretty good. At the same time, of course, it's been short-term, it's been general, and it's been expedient, very expensively expedient, not so good. And I think at the moment we're at now, the cost of living crisis is still there. The way I will know when the cost of living crisis is properly over is because the BBC will no longer have cost of living correspondents. They will go back to their day job in the business team. It hasn't quite happened yet, I don't think. So that's the challenge that I think thinking through an issue, responding to an issue as a crisis has developed. If we go back to pre-crisis, the fuel poverty figures, I don't expect people to be able to take all this on board, and I'm certainly not going to walk through it, but this is the definitions, the metrics, the targets, the level of achievement in England, Wales, Scotland and Northern Ireland for the different fuel poverty targets that we have. What's worth noting is the complexity, the difference, the failure to meet targets, but just that lack of consistency in it. One thing it underplays in particular is the severity of the energy crisis on fuel poverty figures, because this is the government's chart for progress fuel poverty in England. So we're doing incredibly well, aren't we? Government predicts, I'll need to go to the notes for this. Government predicts that fuel poverty will fall in 2024 to 12.7%, 3.1 million households, which will be the lowest ever level on the current definition. The current definition is low income, low energy efficiency. So you have to live in a low energy efficient home and be below the poverty level. That doesn't quite ring true when you try to understand the impact of the energy crisis. There is another metric, which is the fuel poverty gap, which is the amount of money that someone would have to pay to rise themselves out of fuel poverty. That has risen by 67%. So it's a better reflection of the impact of the energy crisis. But this is what the fuel poverty strategy in England, the schemes that are designed to tackle it, the success metrics, the political ownership of it, the driver of it is based around. So we have this disconnect between the experience, I don't need to go into the experience that everybody knows has happened around energy prices and people struggling to afford their home, and the way in which we have a system that structures the way in which we think about it. NEA, I think there's many ways why this is a good metric, because it says, how are we going to measure the success of our long-run energy efficiency programs in sustainably reducing the levels of fuel poverty by energy efficiency, insulation interventions in people's homes? How can we track that that's making a difference? In that way, it's not a bad idea but it's flat. NEA, partly to reflect the needs of the energy price crisis, we say that you're in fuel poverty if you have to spend at least 10% of your income to afford a decent level of heat and power. That's very reflective of the energy price crisis. Even the government would recognise that the numbers in fuel poverty would be 8.9 million households, or would have been in 2023 if they had used that definition. So we have a systemic, structural, strategic problem, especially in England, about the levels of fuel poverty. This is why it's a flat line. We've had a massive cliff edge in the early 2010s of energy efficiency insulation. Well, these are the schemes that are designed to reduce levels of fuel poverty. Massive cliff edge, incremental gains over recent years going into the start of the energy crisis, the expectation of it ticking up. If you dig below these figures, you'd see the level of penetration and rollout of things like eco, which is the primary fuel poverty measures, as being very slow as the nature of the scheme changes, as the supply chain and the skilled workforce isn't there, and as people struggle to find eligible households. So pre-crisis, we're in a bit of stasis in relation to fuel poverty. We've been in reverse for a long time. We're struggling to get our way out of it. We have no metrics or strategy that drives better performance, and we have no actual outcomes that would give you hope of doing anything other than just dampening down the impact of fuel poverty. Comes the crisis. So this timeline stops in October 2023, not because we don't want to be exposed to any good news of prices coming down. We're not professional charity curmudgeons and miserabilists for their own sake, but it's just to give a flavour about the dynamic, which we all know, the dynamic of energy prices over the recent years, the interventions that have been made by government, the cumulative effect on numbers in fuel poverty by the 10% measure. So it's been an extreme picture. And this is what's led to, obviously, it is a crisis. I'm not trying to get away from the idea that it's a crisis, but there's something about the way in which we've dealt with it as a crisis, which is limiting and which might lead us not to take the sorts of lessons and steps that we should have done by such an exceptional event, such as this energy price crisis. And this is pretty much the picture that we're left at at the moment. 6 million households in fuel poverty in the UK by that measure. Energy costs still much higher than they were pre-energy crisis. And these sorts of numbers of people saying their behaviour has changed, the sorts of coping mechanisms. And in many ways, these are the ones that you see most people admit to. There's lots that we know people will not admit to because of levels of shame about being able to attest to it. But this is how YouGov polling saying half the people go to bed dusk. Soon as it starts getting dark, you go to bed because it's warm, you close the curtains, put paper over the windows. That's what you do. You escape and you hide from the weather. You hide from your life, essentially. And 60% saying they ration their heating. Now, in some ways, rationing your heating or your energy use for most people, well, that's just cutting back. That's kind of sensible steps to try and mitigate and protect yourself from the exposure. Most of our clients, the sorts of people that National Energy Action deal with, they cut off, they don't cut back, and they cut back to the bone, and they don't wash their children's clothes, and they don't cook hot food, and they don't put their heating on. All those things that you think are basic things. These aren't coping mechanisms. This is you being forced into appalling choices. In the original title that I was going to use, I talked in terms of we can't allow a qualified failure in responding to the height of the energy supercharged cost of living crisis lead to an unqualified failure in learning the lessons. And that qualification is important. A few slides ago, I didn't give you time to look and I didn't pick them out. That's how hopeless I am with PowerPoint. But in that trajectory of the energy price crisis, not only did you have the move in the price cap and the move in numbers in fuel poverty, you had the moments at which government intervened with various measures to mitigate and soften the impact of prices. This is why it's a hugely qualified failure. The energy price guarantee is the one that kept typical bills down to about £2,500 level, no matter where the global wholesale price of energy and the price cap had gone. And that was £35 billion of expenditure in a very short period of time. And if you ask any government minister, they are seething that they didn't get the benefit, the reputational benefit, the gratitude kind of for it. But it was a massive intervention, an expedient, because it was easy to do, because you just tell companies to do it. The Treasury pays. It's a pragmatic thing. It's a universal action. It's a general, it helped every single one of us. Wouldn't call it a particularly targeted experience of focusing on the people in greatest need, let alone learning how you do that more efficiently going forward into a high plateau of energy prices. But it was an extraordinary amount of money. So not just the energy price guarantees, but the upfront discount of bills in October 2022. And I can't remember, it's paid for by consumer bills over a number of years going forward. So not from the exchequer. There was council tax rebate, which was seen to be an elegant way of targeting low-income households in ways other than direct payment through benefits, or the energy bills, and then the £400 energy bill support scheme over the winter. There was a lot of support in that period of time, and it's not to say that there wasn't. But there is an issue, which is my therapeutic challenge here today, which was the scale of that and the expedience of that. I think there's going to be consequences for the way in which we learn the lessons, and I'll come to that a little bit later on, because the first policy error is too strong a word, is a failure to grasp or respond to the dimensions of the crisis in a way that enabled you to help those in most need and continue that help. The dimensions of the problem, length, breadth, and depth. How many people were affected? Well, actually, everybody was impacted. Almost everybody was impacted by energy bills going on. Some people were impacted incredibly deeply in ways that utterly destroyed their ability to cope. And the length of period of time was kind of meaningful. So the policy error, I think, was understandably, some ways, for very political reasons, to respond to the breadth, the universality of it, and hope that the length of it was not too long. So the expedience of it, the cost of the expedience, as opposed to taking the time to structure a more targeted intervention, has led to them just desperate to get out of it as soon as you possibly can, to get it off the balance sheet and hope it's all over. So there was a difficulty about that. So the breadth of it, typical bills for everybody extended very significantly. The focus on the missing, the middle, there's been lots of ways of describing these folk, but 7.2 million face energy bills without help, which is to say they don't have access to mean-tested benefits or things that could be addressed to them through means-tested benefits, and the need to respond to it. It's all very understandable reasons for the energy price guarantee. The haste by which the language of the cost of living crisis, and therefore the need to do something about it, has dropped, is reflecting in two ways, really. One, the general inflation rate driven by inflation coming down. It's coming to an end. It's a downward path. The length is about the volatility of energy kind of prices. And then the fall in wholesale gas, partly about European storage and good European winters and the market fundamentals in wholesale gas, enabling the price cap to come down, is meaning that, well, that's crisis over then, isn't it? If it was about the breadth, everybody struggling to pay their energy bills, and it's come down by that amount, and we see these sort of trajectories going down, then surely it's illegitimate to keep thinking about it as a crisis. And if it's not a crisis, do we need to do anything at all? I think is the situation that we've landed in. The reason why we still do need to do something about it all is that third dimension, is the depth. And this is where there are no signs at all, even with the price cap coming down, that the burden on those on the lowest incomes has lessened at all. The numbers of people in negative budgets, and by that we mean that organisations like NEA or Citizens Advice or Step Change or any other major advice agencies, when you take a client and you put them through all the measures that are available to you, the whole package of measures that you think will help them manage their way through it, even when you do all of those and you claim all the benefits they're entitled to, you leverage all the benefits and the support services from the energy companies, you maximize their agency within the retail market, you still haven't got enough money to pay for your basics. Still not enough for your rent, for your energy and your food. And that negative budget scenario is the most dominant character across the advice sector now, that and debt. The second policy area is, and it's linked to the depth point, is it's not a refusal, because I never met a minister or an official who wasn't completely aware of the impact of this on clients. But there was a failure to engage, understand, be responsive to the distribution of pain. This obsession with the breadth and the length of the crisis made it very, very difficult. Our anecdotal experience on the front line, dealing with people struggling to make kind of ends meet, was not just that a client with a transactional inequity between their income and their expenditure had a small number of choices. It was the way in which it was reflected across a whole range of different life circumstances, personal circumstances, in lots of ways. So you can see, I won't go through years. It is always the case that single parents come out worse. They're always the ones that kind of have the most struggle matching their income with their expenditure. And we've seen that grow, but you can see across kind of all of these, the compositions of the household type in kind of fuel poverty. The distribution of pain is differentiated by your personal circumstances and your individual kind of profiles. That's true, talking about negative budgets and debt distribution of these as well as the fact that £3 billion of household energy debt, which is a staggering amount of money in the energy industry, is concentrated on people in low incomes with about a £1,200 average debt exposure, which you have to pay before you're able to pay for your energy. So it is the most stable position. And it's not only, so this is the rent arrears. Debt owed is leveling off, dropping down a bit. Consumer debt, essentials debt, especially energy debt, is through the roof. Negative budgets and debt owed it is the lingua franca of every conversation that an advisor will have with a client. And priority debts increasing, with a strong association between that with, I think anecdotally, we would say that about 60% of everybody who gets in touch with National Energy Action for support will express some level of heightened anxiety, frustration, fear, despair, something which you would classify as a mental health kind of response to their financial situation. I know a little bit about the sorts of things that we hear. I don't need to go through these, but it's not just cutting back and cutting off and self-disconnecting, and it's not just going to bed early, it's sociability. There was a big focus on loneliness kind of a while ago, not so much now. The shame of having anyone over to your home, sending your children to school with unclean clothes, knowing what that happens in the brutal playground, dangerous habits. There is an increase in energy theft, in people stealing meters and rewiring meters, explosions, fire, electrocution. The impacts of fuel poverty are so much deeper than just the cost element of it. We know there's a very close association between not just your personal circumstances, but the energy efficiency of your home and fuel poverty. We know there's a very close association between the tenure of your home and kind of fuel poverty. That those most likely to be in fuel poor are those who own their homes But those who privately rent their homes are most likely to be fuel poor, around a quarter of everyone in the private rented sector. And that's despite only 20% of households privately renting their homes, 36% within that 10-year tie for those in fuel poverty. The big challenge, I think, for government in the decarbonisation of heat agenda is the owner-occupier space. How do you leverage the use of an asset and the opportunity of green finance to make homes more energy efficient and more warm, especially for people on lower incomes? The greatest success has been in social housing through the social housing decarbonising kind of fund, where you have housing associations with assets that they want to maximise and they generally want to make better, and they can work at scale, which is not to say they're all perfect. We all know the situation, mold and damp in a lot of social housing, but that's where the great gains have been. Focuses on how do you do it in the owner occupying sector. The opportunity to do it is most present in the social housing sector. The black hole is the private rented sector, where this inability to conceive of what a balanced approach between required regulation to increase the energy efficiency of their home and some way of enabling kind of landlords to be able to recover that through tax allowances or through improving the asset. The value of the asset is something which governments have, this government anyway, has decided is just too difficult to do because of the threat of private landlords leaving the market and leaving homes void, and not a great deal of penetration into the actual reality and likelihood of that. And the location as well differs. Doesn't differ hugely, but clearly worse in areas like the West Midlands, Yorkshire and Humber. But the pockets within this are probably what matters. The clusters are there, but the pockets are here. So that's 90.2% of fuel poor, with the southeast unsurprisingly has the lowest proportion of fuel poor households. Just wanted to come back to this bit on the England measure. The target that is set, especially the 2030 target, the statutory target in law of having to do everything that's reasonably practicable to get to kind of households VPCC kind of or below. 2022 progress is 52%. There's no way in which we get anywhere close to these targets at all. I mean, it's very difficult to conceive of any access, especially with the news from Labour as a prospective government that it's pulling back on its ambition and intention to roll out scale energy efficiency programme. It's pretty broken, and yet this is just quite easy to roll this on. All the targets across all the different kind of countries, except for Northern Ireland, who haven't been able to get a target, are ones which seem so easy just to roll forward and attest to and say we're going to reach towards it, but you get nowhere close to it. The jeopardy, the political jeopardy of having the fuel poverty target owned by DesNes so easily kind of passed is pretty shocking. So pre-energy crisis, the story on fuel poverty is one of small incremental gains in areas, but after a decade of failure. The impact of the cost of living crisis is just an explosion of household budgets to the extent that all the mechanisms that exist have failed and that there was indecent haste to end those support. The big lesson, and I think this is the challenge for me in trying to think how to present this, is quite easy to say, well, then this many billions of pounds gets us out of the problem in terms of direct financial subsidy of bills, and this many billions of pounds gets us to the energy efficiency status for the households that we want. And that's what we argue. That's fundamentally the position that NEA would carry forward, which is there's value in spending that amount of money. But the exposure to those different life circumstances and the impact of fuel poverty accelerated and supercharged in the cost of living crisis exposes us in much starker terms to something which has always been at the heart of NEA, which is We are a fuel poverty charity. We want to eradicate fuel poverty, but our mission is for warm and safe homes, which is a much broader ambition. So where's the intersection that enables us to understand? So if you were to learn the lessons of the cost of living crisis in the way in which we tried to learn the lessons of the pandemic, through better data governance, through better data collection, and through kind of strong levels of data collection about the differential experience of care kind of systems, that there are lessons to learn in that intersection. So we recognise that fuel poverty is a social policy issue that crosses sectors and, importantly here, disciplines, kind of academic research disciplines. Focus has been on economics and engineering primarily, but increasingly we see the expression of fuel poverty, or understand the expression of fuel poverty, in morbidity and mortality terms. And that's, I think, instructive for us in understanding how we kind of change the debate a little bit. So everybody uses the adage, I'm not sure if it was Churchill, so attributed to Churchill, never letting a crisis go to waste. Put it to good purpose. We can argue about the response to the pandemic, but there are ways in which that has been taken on board, because we know with certainty that there's another pandemic coming along. Of course, it's going to happen. It's of a different sort than we thought. Flu epidemic, SARS epidemic, but it is definitely coming on. Quite how we're unable to conceive of there being another cost of living crisis coming along, to be able to understand and mobilize what we know about who gets hit hardest, how it's experienced, the routes you can take to make sure people pick up that support, bewilders me. So public health is the science and art of preventing disease through organised community efforts. Increasingly at NEA, trustees that said it, is that everybody in NEA and the fuel poverty movement is a public health champion. We're a champion for the cause of public health because our mission is around warm and safe homes. Just a few slides, not really necessary particularly, but to identify the correlation between life expectancy, or low healthy life expectancy, not just life expectancy, but good health in later life, how it correlates, not entirely mapping on the fuel poverty geographical dispersion, but pretty closely, very much clustered, low income and in the north. The risk of preventable death increases with deprivation in a very stark kind of way. The relationship with different deciles of economics and avoidable mortality, then you can just go on. So being in problem debt associated with worth self-rated health, linked to indebtedness, and then crucially, the housing kind of stats. It's been long known, and lots of good academic research around the Marmot review highlighting the harm to physical and mental health of cold homes, particularly on children, and around respiratory health. We know there's about 34,000 on an average on a good year. Excess winter deaths around 10,000, which can be attributed to cold and warm home, is contributed to. It's a very well understood relationship. And in many ways, the challenge for organizations like NEA is about understanding more than just that correlation. What do you do about it? How are there ways of engaging with the health sector so this becomes a public health emergency as well as a cost of living crisis? A number of projects that we're doing kind of latches on to the NHS England Core 20+5 health inequalities programme, which all across the NHS in England you need to have regard to. So Core 20 being the 20% most deprived communities in England, plus relates to some of those communities who are most exposed to health inequalities, and 5 of the key clinical areas of health inequality. These change every now and again, but currently it's hypertension, heart attacks, cancer diagnosis, chronic respiratory condition, severe mental illness, and maternity. There is such a strong correlation between that dominant agenda in NHS England to address health inequalities and the correlation with those health conditions that are caused by or exacerbated by living in a cold and damp home. And we know that the return on investment, well, we say this, we know that the return on investment of every pound spent to keep people warm and safe can lead to significant savings, £70 over 10 years to the NHS. So we've had a correlation known for a very long time. We've got the structural mechanism in NHS England, at least, to prioritise the communities, the areas of particular economic disadvantage, and those conditions which are most associated with cold and damp homes. And yet, it's the devil's own job to try and engage policymakers, not just in the NHS but elsewhere, on the ability to link those two in some more practical ways. Just a slide picking up on just the sheer extent in the health system of data about conditions, pathways to support the iteration of it in different communities, and the ability to see that through an equality metric. This is just a snapshot, but the depth of field of that in the health system is just of a different scale and a different intention than we do when we're trying to address poverty, let alone the cost of living crisis. Our key solutions pretty much don't change that much when you're focused on the energy interventions. We will keep saying the same things, improving the energy efficiency of dwellings through the different schemes and more schemes, kind of trying to align, co-opt the low carbon transition in order that it gives greater benefits to fuel poor as well as meeting net zero. Those direct financial interventions to support kind of people struggling to pay their costs, and then market reform, the changes in the market so that you have, whether it's social tariffs or help to repay schemes or the different mechanisms to make it. So in many ways they're the same. There's 2 points of learning, at least in the cost of living crisis. One is the identification of starting from where communities are and the lessons in the health service, because that's not, you can have an obesity crisis. The pandemic was a crisis. There were lots of crises that were responded to in a fast, urgent, expedient kind of way. And yet the learning of it has traveled beyond it, and you understand more about the exposure of different communities, and it's built into different health inequality schemes and programs like the Core 20+5. Not short term, quite targeted in different kind of areas, and to be built on as opposed to be ended as soon as the opportunity gives you, in a similar way, supporting households through the transition. Not quite so urgent, not quite so expedient, but much longer term, and a concern with all the different moving parts. And I think there's an opportunity for us in the fuel poverty kind of movement to learn from both those areas to try and get a proper response for it. So supporting households through the transitions, I won't go through them, but a structured way of aligning the social and economic benefits to low-income households from the different kind of elements of the transition. So my therapeutic intervention for myself is the cost of living should jolt me out of the easy, replicable, repeated claims of just more money in people's pockets and energy efficiency in people's homes. Not because they're wrong, they're absolutely the right things to do, but it's not an either or. The challenge that we've been given across the different, if you were to ask organizations from different points in the anti-poverty movement, they would probably say one of the failures of responding to the energy supercharged cost of living crisis was to get fixated on energy bills, was to see that as the only metric and the only intervention that you could make. Don't worry about benefit systems in the long term. Don't worry about other mechanisms. It was the expediency of the energy bills. Now, as an organisation that wants people to be able to afford to keep their homes warm, we were supportive of those interventions. But coming out of the crisis, you can see some of the limitations of that approach. And it's trying to think our way through how you broaden the palette of options that you have in the fuel poverty movement that's of most value to us. So the processes that the projects that we deliver supporting low income and fuel poor households, the advocacy that we have both with government and energy companies and with the regulators, but more than that, I think the convening opportunity that we have at the end of the cost of living crisis, not over yet, but when the cost of living crisis comes, kind of levels out, is to make sure that the qualified failure of responding to the cost of living crisis, which was to spend billions, tens of billions of pounds necessarily to support people's bills, that qualified failure, qualified because that scale of intervention doesn't lead to the unqualified failure of saying it's gone. The cost of living crisis is over. We don't need to think about it anymore. Please let's not learn the lessons, because that's just another exposure on the government's balance sheet. What are the mechanisms? What are the sectors? What are the other areas where you can learn how to respond to the cost of living situation in ways other than thinking of it as a time-limited, urgent crisis, but as an ongoing challenge where you need to have proper political ownership of the process, not just DESNZ's targets, which should roll over and ignore forever and a day, data collection that identifies the differential experience of people in different circulations and different communities, the mechanisms that are designed to lift people out of poverty, fuel poverty, furniture poverty, all the other sorts of poverty, and how you can reflect that in a reshaped energy market regulatory scheme, the proper response from government and fuel poverty kind of strategy, and a movement that is much more aware of its intersection of energy policy and housing policy and employment policy and educational policy and health policy, and makes that something where we're able really to match our actions to our mission being warm and safe homes for everybody, not money off people's bills. I think I had one more slide, but it's the most banal slide you could possibly imagine. So I'll just move on. So look, thank you. Look, you've indulged me by allowing me to think through a problem that I've got, which I think has to become ever more dominant for us. Otherwise, we will commit the same offence that I'm accusing the government of, which is let's cling on to the crisis for as long as we can because of the profile and the focus and the urgency, or then let's just move on and go back to having a mechanism which is designed just to allow people's coping mechanisms to work again, as opposed to then ensuring they can have a warm and healthy and safe home. Thank you so much.
Thank you very much, Adam. You've covered a huge amount of ground. So thank you for being open to questions as well. So let me ask who's got a question. Simon, illustrated.
Do you think it was your slide? Every £1 you spend on improving an investment in housing is £70. Yeah, devil's advocate. But my first response to that was thinking, well, then why don't the NHS pay the power? You know? And then that made me think. Actually, it's part of the issue here that when maybe it's me, but whenever I've heard people talk about fuel poverty and what you might do to remedy that, it always comes across as an energy sector issue. And what you're saying, quite right, it's not, it's a public health issue. And do you think rebranding, in terms of public perception, in terms of getting the message over there, in terms of effective change, do you think rebranding the whole cost of living crisis, fuel poverty crisis, rebranding that as a public health issue, putting it into that basket. Would that help?
And it's an and or it's an and rather than an instead of. But I think that's necessary. So there's a lot of assertion around not only the return on investment. So it's, in some ways you say it's every pound spent, there's £4 gained in the year. This says there's £70 over 10 years. We've got into the habit, and it's true in terms of insulation and energy efficiency, that everything's a win-win-win-win-win-win-win. There are no trade-offs, there's no problems, it will just happen. It's the sort of assertion that Treasury officials go, all right, well, thank you very much, I'm not listening to any more of this, because you're making a huge amount of assumptions about things would happen. So that's one challenge. But you've got to be much kind of sharper and more challenging with yourself about the way in which you represent this sort of stuff. The reason why I don't think it's should we refocus it all to be a public health emergency is because we know that some of the drivers for solutions still reside in the energy market in terms of the lowest tariffs for people on the lowest incomes, of support for people struggling with indebtedness. So not all the solutions are located, actually few of the solutions are located in the health kind of sector. There's much more correlation and understanding of where the symptoms, where the challenges are. So I think there's still intense valuable in locating that, but the cost thing is absolutely right. And so we talked actually earlier on today about intersections between different, so our big intersection is between energy, health and housing. How do you locate yourself in the middle of that so you speak to all of those things and convene them and mobilize them all in support of it? Well, that's usually energy coming to health and saying, I've got to disperse a certain amount of money, or I want to reach out to can you help me? What can you do to help me? As opposed to really opening yourself to, well, I'm a health economist or I'm a health commissioner. Here's my kind of priorities. So let's not talk about the things that we can easily agree on. Let's talk about the things that are quite difficult. So there's a certain amount of recognizing the intersection, but refusing to do, well, not being able to step into what that actually means in terms of understanding where there's a shared solution. It's a bit of a rambling kind of answer, but there's an act of will. There's also an act of approaching what that intersection of issues would actually mean, rather than I want to do my project with your people, with your patients, with your clients, with your residents, which I think is there's been a lot of that. Some of the projects we're doing are deliberately trying to expose ourselves to the priorities and concerns of health professionals, as opposed to just trying to get their referral pathways.
So for me, personally, I think the message was given that the consequence of Britain stepping backwards in time, with people dying on average, earlier than they were. So things are getting worse. That's a much more shocking picture than perhaps it somebody has to go to bed when it gets dark, not to keep warm. That's not good, obviously, but it's more shocking to me to hear that we're going backwards in time.
And this is the exposing yourself to that, the blasé, it never gets a column inch if the numbers of people dying of the cold don't get above 10,000. Doesn't get a mention. It's only when you have the beast from the east, or you have some size where it's a big, and it's like the response to the cost of living crisis. It's only when you get huge volatility in those numbers that people say, well, this is something that we need to take out. So actually, that's a very good challenge back. What is it you're here for? Are you here to reduce bills a little bit, or try to influence the regulatory framework of the energy market, or are you trying to save people's lives and health?
I was under the impression that GPs were already able to prescribe improvements in home heating.
There's a lot of warmth by prescription going on, but it's one of those things where there's lots of oases of really fantastic work, and there's a huge amount of desertification around it. So in certain areas, and there's the nice guidelines, Helen would know better than me, that have been around for 13, 14 kind of years, which is the structural way of identifying the links between and the actions that different parts of the health sector should take. But they're busy folk. And the demands on the health sector, then the hierarchy and priorities that they have are very difficult to intervene, which is why shifting the focus away, adding to the focus, not shifting the focus, it's adding to the focus on people on prepayment meters, or people in debt, people off the gas grid to people suffering with hypertension and respiratory conditions and kind of mental health is an important one. So you understand just the way in which different people experience it and can be solved.
Thank you very much. It was very interesting, and I think you reinforced the fact that trying to tackle this in crisis is just like literally not the way to get about it. I mean, the only other thing they could have done in order to get money through the door quickly was to cut VAT. There were literally no other things that you could do to deliver money to people urgently. So they were in a tight spot. One has to give them that. But it seems to me that when you're competing for money against other worthy causes in the energy bill, and I'm sure you've done this, the question isn't what are the returns that you win. The question is how much more carbon can be sequestered by spending money on home insulation than on more wind farms. And in the poverty bill, the question isn't whether you improve people's standards of living, it's whether spending money on this benefits people more than, for example, ending the 2-child limit on child benefit. Those are the choices that ministers in their departments will actually be dealing with. So I think those kind of comparatives are really
They are, and I mean the fiscal situation. I mean, you choose your own fiscal rules, to be honest, and you decide your own mechanism for understanding how much money you've got to invest. But the drawdown on government spend, pandemic, and cost of living crisis was absolutely extreme. Now, I am very sympathetic in many ways to the fact that my challenge to government response was, this isn't hindsight. You'd been told about this kind of tip up in wholesale prices for a very long time, and you waited to the last minute, and it was bright young things in the Treasury saying, "Oh, we'll just give money to the energy companies." So the way in which you responded to it was, please don't let us have to do anything. Okay, we have to do something. Let's do something that's hugely expensive, supporting people who may not have needed all that amount of support. So let's get out of it as fast as we can. So that's the challenge with the crisis response, that, please, let's just get out of it. One of the moments of rare reward and pleasure in the organisation in policy terms was when we got a commitment about 3 fiscal events ago to a social tariff, a mechanism that would be broader than just means tested benefits, but try to understand those people who are in greatest jeopardy, most exposed to high energy prices, least able to manage it, and can restructure something given the whole of the industry and the regulator and all the consumer organisations kind of wanted it. Can we do something that would require government intervention to at least to hardwire into the system some mechanism that wasn't hugely expensive, but understood and responded to the cost of living situations? Now, that's gone the way of all flesh, and the way of bringing your 2 examples together, I don't think that's on the cards at the moment. We're going to push really hard for it. The way in which it may come back on the cards is thinking of it in energy systems terms, is how can you get proper flexible retail markets established? How can you reduce the exposure of low-income households to the inevitable higher network costs on the standing charge? How can you do the other things which have a policy distribution of costs impacts on, well, a social tariff would be a pretty good way of being able to insulate those people most exposed to it in order to enable you to accelerate those other innovations and steps in the energy market. So I think there may be ways of thinking both in terms of those steps which enable a kind of more net zero driven energy market, and at the same time protecting low-income consumers. But I always like a neat kind of win-win, and I've yet to see anybody particularly enthused by it in government.
There was a question at the.
Can I make some observations rather than ask a question? If that's okay. My standing charge last night I checked had gone up from 55p a day to 70p a day. I mean, when I saw that, I cannot believe the impact that there's going to be. So many people switched off their energy completely over the winter. and yet they will not, they're still paying this enormous amount of money. 22% of our population live in poverty. That means we can easily say a quarter of people are really struggling with their bills. So when you talk about GPs, I've heard GPs talk about, we know there's mold on the wall. The person has a problem with breathing. I send them home and I know they're still going back to that house with mold on the walls, and I can't stop that. I can't fix the bigger issue. We talked about obesity, you talked about education, you talked about prioritising what health services are going to focus their funding on. But fundamentally, the problem in our country is much bigger than fuel poverty. It's about inequality. It's about the discrepancy between those who have a lot of money and those quarter of the population who don't have enough money to pay their bills. And until we go to the deeper issues, I sit here and I just despair. I really do. When you look at what the local authorities are dealing with, Tesco today announced enormous increase in their profits, and yet we've got this cost of living crisis. It started off with an energy, fueled by energy prices, but right now the supermarkets are making a mint out of this cost of living crisis. And the government, in my personal opinion, they don't do anything because they don't want to, because it's a political decision not to do anything. They don't care. They're taking carers to court at the moment because they overran their budget by £1 and they allowed the algorithm to keep running for months until they owed £20,000 back to the DWP. It's just shocking when you see what and these are the poorest people in society. 53% of your people are disabled. So my sense of frustration is enormous, and I think the basic issue is our fiscal system and the inequality we have in our society. So I really commend what you're doing, but I feel like the issue is enormous.
No, and I think that's a really important point to make. It was supercharged by energy costs initially, but currently, even though I think the price is around £400 on average higher than it was at the start of the crisis, which is an impossible area. And as an organisation, we're focused on those folk who are struggling to afford the price of a warm home. But rent and food is off the charts as well. So when you track essentials inflation and the rate at which that's falling, energy notwithstanding, it's still incredibly hard, which is why I'm saying that the organisations, our nearest and dearest, the ones we work with most closest, are a bit frustrated with the focus on, were frustrated in the cost of living crisis on the focus of energy as the cause and energy as the only delivery mechanism you had for a solution, because it's about deprivation, it's about destitution, it's about inequality, it's about poverty. And I'm absolutely with that. So commend the work of Joseph Rowntree Foundation and others around the essentials guarantees, so that in order that everybody should have, the ability to respond to their actual needs. So it is a massively frustrating kind of area, and the big anxiety. I think what's unforgivable is coming out of, I understand the focus on the cost of living crisis and it being able to be less of a focus. What's unforgivable is not learning the lessons of who got impacted the most, how you could support them, how you could get through to them, how you could sustain them in those conversations, what the government policy failures were, especially those that were designed and deliberate to act the way. So that's the unforgivable bit. So I absolutely get you on that. Understanding kind of charge, our clients, we only deal with clients in the most desperate straits. So often there'll be people on a prepayment, maybe forced to be on a prepayment, repaying, the average of £1,200 of debt and having to pay their standing charge, whether they use energy or not. And then after that, have they got enough money to actually buy fuel, energy on their meter? So it is unsurprising that all the myriad issues around either the energy supercharged cost of living crisis, the cost of living crisis generally, it's the nature of inflation, of essentials inflation. Yes, the people the least able to shoulder it that get hit the worst. And I thank you for that kind of passion.
We could take more questions, we could continue, but what I'd like to suggest is that we thank Adam very much. We're going to give a small token of our appreciation, which is a book about Durham's coal history. You can enjoy a walk around Durham and think about its deep roots in energy issues. And please continue the conversation informally. Help yourself to a drink. We're in the fortunate position of being able to share that. So please do stay and chat and continue.
Thank you very much.
Thank you, Adam.